Hello everyone, Dr. Rawls here with the ultimate Lyme question. Does chronic Lyme disease exist? According to the CDC, the Centers for Disease Control, and most physicians, it doesn't exist. Then why are so many people suffering? Why are so many people having symptoms that they attribute to this microbe because they had a positive test at some point? And it's really because it's difficult to find once it is in the body. We know that acute Lyme disease often doesn't cause symptoms in a lot of people. You can get bitten by a tick, you can have a very mild illness, and whether you receive antibiotics or not, you may not ever be symptomatic again. So when the patients that I commonly see that identify with chronic Lyme disease, many of them don't remember a tick bite. They're chronically ill with a whole spectrum of symptoms, and at some point they've had some identifying factor that makes them feel like that they are carrying the microbe that causes Lyme disease, called Borrelia. But typically they're carrying other microbes too. It's not just Borrelia, it's other microbes in addition to Borrelia. So when I look at this thing that we're identifying as chronic Lyme disease, I'm looking at a core of chronic immune dysfunction, that the immune system has been disrupted by not only Borrelia, but other microbes too. So the thing that throws the physicians off is that when you look at microbial illnesses, they expect that you're going to be able to cure that with antibiotics. It goes back to more virulent microbes like the ones that would cause pneumonia, where you test for the microbe, you find out what microbe you have, you treat it with antibiotics, and you test for the microbe again. The microbe's gone, the patient doesn't have any symptoms. These are totally different kinds of bacteria. Those are extracellular microbes. They localize like in the lungs or on the skin, and they have an invasive infection. Whereas Lyme disease, the microbes are intracellular. That's a whole different type of microbe that doesn't respond well to antibiotics. So it's very, very difficult to treat. Often people can have a positive Lyme test in the beginning and then later not have one, because once these microbes are in the tissues and deeply in tissues, they're not in the bloodstream, they don't show up on direct testing for the microbe, and the immune reaction has become attenuated, even suppressed by the microbes, such that you don't have the normal reaction of being able to test for antibodies to it. So it can be there and not be present. A study that really got my attention that came out several years ago is they took a group of people from around the country that had all the symptoms that define them as having Lyme disease, but they had had a negative test in the beginning. All of the people, and it was only about 10 or 11 people in the study, but all of the people had a negative Lyme test. They had all of the symptoms that they thought they had Lyme disease. They had been treated with 6 to 9 months of antibiotic therapy. So this lab took a very special culture media that they were able to pull microscopic amounts of bacteria out of the people's tissues and blood samples. And it was really interesting. Again, negative Lyme test, treated for 6 to 9 months with antibiotics. A third of these people, they were actually able to find Borrelia in their system. So that in itself suggests that our testing isn't good, that the microbe can definitely be there and not respond to antibiotic therapy and still cause symptoms. So yes, I believe that chronic Lyme disease does occur. And a few physicians are starting to come around. For the first time last year, there was actually a study published that with a title of chronic Lyme disease in the title, which was that was really interesting. So I think some physicians are starting to come around and recognize that these microbial illnesses are very insidious and sometimes very, very difficult to diagnose. Until the mainstream catches up, though, you can find out a lot more information about that, of these kinds of topics at my website, rawlsmd.com. And also, please take the time to sign up for our newsletter to learn more about these kinds of interesting topics. Thanks for watching my video. I hope you found it helpful. Be sure and subscribe to my channel so you don't miss any upcoming videos. And while you're at it, please take the time to leave me a comment. I would really like to know of any questions that you might want answered in future videos. Thanks for watching.